Welcome to the Medicine and Science podcast from the BMJ. I'm Sophie Cook, Head of Clinical Content at the Journal, standing in for Cameron Abbasi. We've just had our annual climate edition, so in today's podcast we'll be discussing climate change and conflict.
That can also possibly be a trigger which can be exacerbated by climate change.
Why SUVs are road and climate hazards.
The height of the bumper, the location on the body that the injuries occur, the injuries can be more severe.
And we'll be looking at women's health innovation.
Innovations without equity can actually reproduce the same hierarchies and discriminations that those innovations claim they wish to disrupt.
Today I'm joined in the studio by Andy Haines, Professor of Environmental Change and Public Health at London School of Hygiene and Tropical Medicine. Welcome, Andy.
Thank you.
And online by Juliet Dobson, the BMJ's Managing Editor.
Hi, Sophie.
And Barbora Sedova from Potsdam Institute for Climate Impact Research.
Good afternoon.
Hi, Barbora. Juliet, let's start by talking a bit about the issue this year and some of the big themes that our authors brought up.
Yeah, so this is the 5th year that we've published an annual climate issue in the BMJ. And the focus this year is Brazil. The reason being that COP30 is taking place in Belém in the Amazon in Brazil. So we wanted to focus on how the climate emergency is particularly impacting on the Amazon. So we have a series of pieces written by Brazilian indigenous authors talking about a number of different themes, particularly around the Amazon and how it's this vital ecosystem for human and planetary health. But it's really in danger. And at the moment, the Amazon, it's this source of biodiversity and nature. It's a carbon absorber. And it holds so much knowledge from the communities that live there in terms of protecting the rainforest. But it's at risk from deforestation, from cattle grazing, illegal mining and oil extraction. And so the pieces really explore the impact that that's having on the communities that live there, but also the impact that it has on the whole world.
Thank you, Juliet. Can you tell us a bit more about the cover as well? Because that's quite interesting. We've drawn on the Brazil content for that and tried to work with a Brazilian artist.
We have, yes. So the cover was commissioned from a Brazilian illustrator from an indigenous community called Kath Zappi-Puri, and she worked on it in collaboration with another illustrator. And the cover really depicts the Amazon, but also the role of women and children in the Amazon, and nature and biodiversity. And she gave a really beautiful description of what the cover is really meant to mean. And it's not just showing the Amazon and the people living there, but also them kind of living as one and living as part of the forest.
Thanks, Juliet. For you, out of all the content, were there any pieces that you particularly enjoyed reading or editing, or anything where you think there were particularly important messages for our readers?
Well, I really enjoyed the piece about biodiversity and how the Amazon is this rich source of biodiversity, and the climate emergency and climate crisis and biodiversity are these two twin crises that we need to tackle simultaneously. We talk a lot about climate, but actually this is a health issue, and the issue does include some original research and education articles as well. So, Sophie, do you want to tell us a bit more about those?
Absolutely. Thanks, Juliet. So we've got a couple of research papers, one of which looks at the impact of tropical cyclones on mortality and health, and also another one which looks at how living near green spaces can impact on mental health admissions. And in our education section, we've also got an article which, although not directly related to climate, it is an environmental issue, is noise pollution. And that's not perhaps discussed as much or given as much airtime as some of the other health effects that we see. And we have a really nice What Your Patient Is Thinking article, and it was written by a woman who lived in Indonesia, and it reflected on her own experience being pregnant and then a new mother in an extreme heat wave. She describes the problems she had with breastfeeding, the effect it had on her baby, and really sort of raises awareness about how we need to think more as health professionals about how heat does affect the postpartum period.
Great. Thank you, Sophie.
Thanks, Juliet. Well, we'd urge everyone to have a look at the content online. There's plenty more to explore. So thanks for sharing your highlights with us. Andy and Barbara, you've been really patient listening to that. Thank you. But we've got you here to talk a bit more about the article that you wrote for the edition, which is tackling the complex links between climate change, conflict and health. So we are seeing an increase in conflict around the world, unfortunately, at this time. And climate change, we know, is intensifying. And both of these are leading to loss of life and health harm. So Andy, to set the scene for our listeners, could you tell us a bit about the scale of the health problems that we're seeing as a direct result from conflict and climate change?
Well, of course, climate change is becoming manifest around the world, as you say. And thanks to advances in what we call attribution science, we can increasingly link health effects to human-induced climate change. In other words, separating them out from natural variability. So, for example, over the summer, some of my colleagues at the London School suggested that about over 70% of the extreme heat-related deaths in Europe could be attributed to human-induced climate change. And if you just take the 2022 and 2024, there were about 60,000 heat deaths, something of that order, in Europe alone. So you can see that on a global scale, it would be quite substantial. And of course, these deaths are likely to increase with climate change, but direct effects of heat are just one pathway. I mean, we're also seeing changes in infectious diseases, reductions in crop yield, a whole host of different pathways affecting both physical and mental health. And of course, climate and conflict is an emerging area that we wrote about in our comment, really trying to explore the complex linkages between the two.
So for a while, we've been hearing about the potential for climate change to exacerbate conflict. Do we know that that's actually happening now? And do you have any sort of case examples about that?
Nobody will be surprised when I mentioned the Sahel and probably the farmer herder conflicts where herders need to change their routes due to climate risk and increasingly enter the farming areas. Many violent clashes between farmers and herders in the Sahel are happening. So the prospects are not looking great given the intensifying impacts of climate change.
I think the example of the Sahel is a very good one. There have been a number of studies suggesting, for example, in countries where you've got what they call ethnic fractionalization, multiple ethnic groups that may not necessarily, may have cultural differences and so on, including this tension between the herders and the more sedentary farmers. These can be a situation in which the risks are increased. Also, where you get droughts, particularly in the growing season of crops, and you've got an agriculturally dependent population, that can also possibly be a trigger which can be exacerbated by climate change. So there are a number of different pathways by which climate change can directly or indirectly influence conflict. And also, of course, climate change makes recovery from conflict that much more difficult as well.
And what's especially worrying is that the countries most exposed to climate impacts often also have the weakest health systems, and many of them are already dealing with instability and conflict. So really these fragile contexts are areas which can get trapped in the vicious cycle of reinforcing climate impacts, conflicts, and deteriorating health.
So can you tell us a bit more about that, Andy or Barbara, about the evidence and the data about who is most vulnerable to these synergistic effects? Who are we seeing affected most in this situation?
Well, in terms of vulnerability, there's geographic vulnerability. People in low and middle-income countries are often held to be more vulnerable. But we also know that some groups in relatively high-income countries are vulnerable too, the elderly. And increasingly, we're understanding that extreme heat and other climate impacts can affect a pregnancy and young children as well. So it's a very rapidly evolving scene, I would say, and we're probably underestimating the impacts both of conflict and of climate change, because conflict also has impacts which are beyond the direct effects of the bombs and the bullets and so on. We know that populations that live within 50 kilometres of conflict, for example, have higher risks of maternal and infant deaths. One study suggested perhaps 10 million children killed as a result of conflict over a 20-year period. And many of those deaths would occur indirectly through the disruptions of healthcare systems, supply chains, violence of various kinds due to the breakdown of law and order. So it's a kind of toxic mixture, really, of both climate and conflict, which is driving ill health in many parts of the world. And of course, conflict-affected countries also have difficulties in adapting. because now it's very clear that we have to adapt because we're already virtually at 1.5 degrees centigrade. And so we've almost certainly lost that Paris Agreement target. So we have to adapt as best as possible. And yet those fragile and conflict-affected states have the most difficulty in adapting. Sometimes they don't get sufficient funds. And when they do get funds, it may not be administered in the best way, because you really have to engage the communities if you want to have an impact on climate adaptation. So it's really a mixed and, as we've heard, a synergistic picture.
Mm. It's worrying, and I think with so much conflict around the world and climate change accelerating, as we said, we really need to think of solutions. I mean, what do you think needs to happen next to reduce the harm that we're seeing?
Well, there are two responses you can have, or at least two responses in climate change terms. One is to adapt to the changes that we can't prevent. So create more resilient healthcare systems, more resilient supply chains, more resilient food systems and so on that underpin human health. But also we have to mitigate. And in climate change terms, when we talk about mitigation, what we mean is cutting greenhouse gas emissions. So CO2 is the one that everyone knows about, really, because it's a long-acting greenhouse gas. But there are also what many people call super pollutants because they're much more impactful molecule for molecule than carbon dioxide. Like methane, for example, which comes from ruminant animals, from rice paddies, from gas leaks, and so on, and other greenhouse gases as well. So we have to act on all these greenhouse gases simultaneously, and we're just not doing that at the necessary speed and scale. But I suppose the other side of that, the good news story, is that when you do mitigate, you can get big health benefits, near-term benefits, over and above the benefits of reducing the risks of climate change. So you get, for example, benefits from reducing fossil fuel-related air pollution. We published that paper in the BMJ a couple of years ago showing that about 5 million premature deaths a year could be attributed to fossil fuel-related air pollution. And there are other preventable deaths from unsustainable food systems and the kind of limited dietary choices that many people have, unsustainable transport systems and so on. So these are deaths which can be prevented in the near term and bring these added benefits over and above preventing the risks of climate change.
So of those things that you've just discussed, Andy, and then I'll come to you afterwards, Barbara, what do you think, which one change in particular do you think is likely to be the most impactful?
Well, it depends whether you mean impact on the climate or impact on health. If we take the climate for the moment, I mean, clearly it's a fossil fuel phase out that's really crucial. And that's, of course, something which is not really fully on the table in Brazil, as we've heard. Unfortunately, it should be, but it's not. Some nations are pushing for it, but others, of course, are resisting that because their economies are based on the exploitation of fossil fuels. So I think that's the big prize that we need to aim for, is actually reducing and ultimately and rapidly, in fact, phasing out our dependency on fossil fuels. And that will bring major health benefits. If we can do that in an equitable way, what we don't want to do, of course, is increase energy prices that disadvantage the poor and so on. So it has to be done in a just and a fair transition towards a net zero and healthy economy.
And Barbara, what changes would you hope to see?
As already pointed out by Andy, I think both stepping up mitigation and stepping up adaptation is key to, reducing all sorts of climate impacts, including those on conflict and including those on health. For me, stepping up action on these two fronts is crucial, but simultaneously it needs to be ensured that climate action, both mitigation and adaptation, are compatible with other global policy priorities, that they don't reinforce inequality, poverty, or that they are basically compatible with peace building efforts. So trying to make climate action synergetic with other decision-making along the sustainable development goals is, I think, the priority at the moment.
But we know how poorly that's happening. Do you think that we can get from talking about this to actually being effective?
Yeah, I mean, I do. And I think the hope is in intersectoral and interdisciplinary collaboration. So I really believe that research and science should collaborate together, because the crises are getting more and more complex, requiring more and more knowledge from different areas. And an understanding from different areas. And again, once we have this knowledge, this needs to be effectively translated and communicated to decision making. So I truly believe that evidence-based decision making could be very helpful in this area.
This is something that we've been long advocating, because many of the determinants of health, whether they be social, economic or environmental, are of course mediated by policies outside the direct control of the healthcare sector. And I think those of us that have worked a lot in healthcare have not always been very good about reaching out to colleagues in other sectors. And sometimes when I've had the opportunity to speak to decision makers, to ministers or whatever, I've said to them, look, you may be the Minister of Energy or whatever, but actually you're a Minister of Health, whether you like it or not. And the sooner we recognise that, the better. So we do need, I think, much better governance mechanisms at the kind of cabinet level that would take responsibility for this interrelationship between human health and environmental sustainability. Because I think that politically, not many people are prepared to really vote and campaign for the environment. That doesn't really resonate, much as we might hope it would, with many people. But when we talk about health, the health of their family, of their loved ones, that does resonate much more. So I do think the health message working through different sectors can really have a much bigger impact than using the kind of traditional arguments around, environmental sustainability or whatever it is. And I think we need to look for countries which have successfully managed to integrate intersectoral action. And a lot of that integration actually occurs at the subnational level. So when you talk to city leaders, they are much more attuned to the idea of working with different sectors to deliver benefits for their local population. They're often much more in touch with their population than a national leader is. And perhaps that's where we need to look for some of the successful examples.
And if we turn our attention just briefly to COP, you did mention COP, Andy, we know that outputs from COP have been disappointing over recent years. What are your biggest hopes for the conference this year? And are there sort of any particular changes that you hope to see as a result?
Well, I think obviously there's an opportunity to build on the Health Day, which is occurring at the moment. I would say that the Berlin Health Action Plan does focus really almost exclusively on adaptation. And I think many of us hope to see a more balanced plan, which would include both adaptation and mitigation. But we are where we are, and adaptation is an important topic to emphasise and to implement. I think what we really need, of course, is real action and not just speaking. And that's always the challenge with COP. What kind of actions are going to follow from COP? And we need to see a greater mobilisation of funding, because funding, as we know, has been inadequate. And actually that takes us back a little bit to the whole issue of conflict and arms, because it's been very striking how military expenditure has increased over recent years. And the most recent data suggests $2.7 trillion a year that we're spending on arms. And, by coincidence or not, that's roughly the same amount of money that we need to decarbonise the energy system globally. So, of course, I'm not naive enough to imagine we could just transfer arms spending to climate. But if we could divert some of that military expenditure to fund adaptation and mitigation actions and an increasing transfer of resources from militaristic to peaceful purposes, we could address many of the challenges facing the world at the moment.
Indeed. Thank you, Andy. And Barbara, any thoughts from you on COP and what you hope to happen this year?
Yeah, thanks. So for me, I can only second Andy's points on, not only talk about plans and ambitions, but also implement them and see some action. So I think more ambitious NDCs or nationally determined contributions would be one really important area of action. And another one would be to implement the climate finance commitments of the global North countries to support global South countries in implementation of ambitious climate action plans. So really action on both fronts. And when I say action, I mean action, not only commitment, is, I think, key at this stage.
Do you think COP in its current form is still fit for purpose and, given the criticisms of recent years, or is there another model that you think would work better?
Well, you can't just abandon COP. I mean, obviously, the fossil fuel industry, I'm sure, would be delighted if we abandoned COP. They wouldn't have to send so many thousands of people, spend all their money lobbying COP, which they do at the moment. So we can't abandon it. But COP is not the only game in town. There are lots of activities occurring at the national and subnational level which need to be reinforced. There's still quite an appetite amongst city mayors, for example, for action around adaptation and mitigation of climate change. And as we know, there's quite a lot going on in the healthcare sector itself, which is responsible for about 5% of emissions. Incidentally, the military sector is responsible for just over 5%. So you put these two together and you've got a substantial proportion of greenhouse gas emissions. So I think we need to reinforce and support many of the actions that are going on outside COP. But with regard to COP itself, I think what needs to be done is, first of all, there needs to be some restrictions on who can attend. I don't think that people who've got an obvious conflict of interest in increasing the use of fossil fuels should be allowed to attend. Of course, at the moment, I guess the UNFCCC doesn't have the power or the influence to prevent them. But I think that's a reform which is, frankly, long overdue. And then secondly, I think we'd like to see human health and human outcomes more generally at the core of the negotiations. It's not just about reducing greenhouse gas emissions, although that's absolutely vital. We also need to make sure that the interests of the world population and of course the security of our planet, planetary health, which is the integration of human health and the health of natural systems, that needs to be much more foregrounded in the negotiations. I'd like to see more health representation on the negotiating teams, for example. That would be really beneficial. So there's quite a lot that can be done to reform COP as it is. But we shouldn't limit our actions to COP. We should also be doing a great deal of work between the different COPs.
So, Andy, you've written another opinion piece for this issue with Jess Beagley and Fabio Cresto Elena, where you highlight the need for governments to do more in terms of their nationally determined contributions and how health doesn't really factor into many of these plans. So can you tell us a bit more about that?
Yes, this term nationally determined contributions, NDCs, not NCDs, which will be more familiar to probably your listeners. These nationally determined contributions are the commitments essentially that countries make under the Paris Agreement. So they have to file under the terms of the agreement, they have to file their commitments to reducing greenhouse gas emissions and adapting to climate change. And we know that within those NDCs, there are big potential opportunities to benefit health. For example, from reducing fossil fuel burning, reduced air pollution, more sustainable transport systems that support walking and cycling, more sustainable food systems that support food security, and also healthier more sustainable diets. The problem is that although about 90% of them or so make some kind of reference to health, and about 2/3 refer to adaptation actions. But less than a third really identify the kind of health benefits of mitigation. And the problem is also that many of these statements are very high level, so they don't really have an implementation plan attached. So they're of limited value in that respect. And there's really an opportunity, I think, to build on these NDCs, which are official government commitments, to really make sure that health is much more embedded in those commitments. And we suggested 4 specific things that could be done. One, of course, was to align the national emission reductions, the greenhouse gas emission reductions, to the Paris Agreement target, which many nations, of course, are not. And that includes both carbon dioxide and these super pollutants like methane and nitrous oxide and others. The second is to take action in the healthcare sector itself. So we know that the healthcare sector is responsible for 4 to 5% of emissions more in the USA. And there's, as we know, a lot that can be done within the healthcare sector to reduce emissions, but also to create much more resilient healthcare systems that are more resilient to extreme heat, floods, etc. The third thing is this point about intersectoral action. It's something we often talk about, we're not very good at doing. So really working with colleagues in other sectors to maximise the health gains of these sectoral policies by reducing inequalities, for example, or also by capitalising on the health co-benefits of better energy policies, better transport policies and so on. And the fourth is really important as well, and that's really focusing on implementation, because I've mentioned many of these are very high-level statements, and what we need are implementation plans with clear targets and milestones. So implementation and evaluation and monitoring to ensure that we're really making progress are absolutely crucial. If we could put all those things together, then I think the NDCs could become a really important tool for advancing climate change and also advancing public health. Thank you.
Andy, Barbara, thanks for joining us. And those articles we've been talking about are all freely available on bmj.com, and we'll add links to the podcast notes to help you find them. As we've heard, tackling issues that impact the climate are also really helpful in improving other health problems. And as part of the issue, we've also published an editorial looking at SUVs. The growth in both the sales and the size of SUVs is increasing both road pollution and the severity of injuries that pedestrians and other drivers experience after being struck by one of these cars. Earlier this week, I spoke to Anthony Laverty, Associate Professor of Public Health at Imperial College London, and trauma surgeon Cleo Kenington. We discussed the health effects of this car spreading. Cleo, as a clinician who's seeing the trauma inflicted by motor vehicles, what prompted you to want to write this editorial?
Within my work looking after victims of trauma, it's well acknowledged that about a third of our cases are elderly people who've had falls with low impact trauma. A third are motor vehicle collisions, and about 5 to 10% are penetrating trauma, and the remaining 20 to 25% are other things. And we have a lot of work within the hospital at prevention. So for the elderly patients, there are lots of clinics focusing on preventing elderly people from falling, picking up those at risk, providing treatment to prevent them from falling over. For the youth violence, we have a lot of work within the hospital supporting these young people to prevent them from going on and having further injuries. But we don't have any concerted prevention programs led by the hospital to protect our patients from road collisions and the dangers of this.
And I think if it's all right, I was going to say, Cleo, I remember when you and I talked recently, you had talked about how, I mean, there are surgeons who are sort of out there in the media talking about knife crime, talking about those penetrating injuries, but there hasn't really, I think, been any of that thus far around these vehicles and their added danger.
So it's quite obvious to me that I'm seeing more and more of these large cars on our roads. And as you say in your editorial, they now make up 63% of new car sales as of 2024. So Cleo, as someone who deals with the impact of these on patients, what has this meant for your trauma work?
We can see when I have been involved in cases which were definitely involved with SUVs, the injuries can be more severe, more difficult to treat because of the mechanics, like the weight of the car and the height of the bumper, the location on the body that the injuries occur, that the injuries can be more severe. If it's a peripheral injury, more like a limb injury, we are more able to treat those. If it's a brain injury, once the injury is done, we can do a lot to prevent the injury worsening, but we can't undo the brain injury. And those are more common, like we've said, in injuries related to SUVs.
And you mentioned also in the editorial about sort of the impact on children as well.
Certainly, when a child is hit by an SUV, especially because the height of the bonnet is the same height as an 8-year-old, it can have a much more devastating injuries.
Anthony, what sort of data do we have about the injury and pollution effects of SUVs at a country level?
So last year in injury prevention, we published this systematic review. Really the question was, if you're walking or cycling, if you're hit by an SUV, is that more dangerous than being hit by a normal sized car? That found sort of 24 studies. Quite a lot of them were in America, but, it was very clear that, for adults, we talk about this 44% increased odds of dying, and that's higher. It's sort of 82% in kids, which, is what we would expect, if we think about the size of them and how they hit kids, as sort of Cleo talks about. So we have good data, I would say, on the road injury picture. We have probably less good data around the pollution specifically. You have to piece that together a bit more. We know that they are, as I say, producing more tire wear, producing more brake emissions. And we know that that's a big contributor to the pollution we see in urban areas particularly. And we know obviously very clearly that, outdoor air pollution is very negative for health. So I think we can, be clear in our minds that this is what is happening, but that, the data on the real specifics are probably a bit more lacking there. But I mean, I would say, certainly my opinion is we know enough to say, well, this is really a problem that we should, think about trying to deal with.
Anthony, people often buy these cars thinking that they're going to be safer for their families, and that's a big factor in their decision. But obviously, we are now seeing that that's not the same for those outside of the car. So what information do you think people need to be given or need to be aware of when they're contemplating decisions like this?
Yeah, it's a good question. And I think it does help to think, about why people are making these decisions. I would say, I'm very much structural determinants of health, public health, person, and would advance those arguments. And when we can talk a bit about the individual decisions that people are making, but car manufacturers are, producing these cars. They're getting larger, they're getting heavier, they're getting wider every year, and that's a choice they've made. They're putting big amounts of money into marketing these cars to people, as you say, partly based on saying, this will be safer for your family. And so, I think it's worth thinking about why there are so many of these larger cars on the road. In terms of people's individual decisions, I think, being clear about these extra risks is helpful. Lots of people, and who can blame them in a way, are not, thinking, when they buy a new car, they're not thinking what's going to happen if I run over a 10-year-old, right? That's not really part of people's thought process. But I think, raising awareness around the fact that maybe this is safer for you inside, although I'm not entirely sure of the evidence on that. But, we're very certain that, there's these extra risks to people outside your car. So I think, being clear about these things can help.
I was struck in the piece about the relative difference in tax between France and the UK on these cars. Can you tell us a bit more about that and whether this was a deliberate public health policy from the French government?
Yeah, it's striking. I think the it's a 20-fold difference, a sort of acquisition tax to have a larger car in France than in the UK. So obviously, that's big numbers. I don't know particularly whether it's much higher in France because they've thought particularly about these public health arguments. But I guess what I would say is, if we think about sort of vehicle taxation, including also, things like fuel taxation, Britain hasn't gone very far in terms of thinking about what are the health impacts of these things. It's not even, in the conversation, what would happen to, any sort of health metrics. So that's very much something which isn't considered, but, very much could be. And we know, I would say what we know from lots of, public health things is, changing taxes, changing prices. Firstly, it's one of the big levers that governments have. But also we do know that does change behavior. And, we think that, if there were fewer SUVs, that would change health outcomes. So it seems like a missed opportunity to have these, levels of taxation on these larger cars, which are, much lower than, quite comparable geographically close places.
So as a result of, raising the awareness of this in the editorial, what would you both like to see happen next? Cleo, perhaps I'll come to you first.
I hope that more doctors will read this article and understand the health and safety implications of SUVs and realise that it's not cool to have an SUV, and use their power to not buy SUVs and not drive cars like this, as well as advocating for changes in policy to mean that less people use them as well.
Thanks, Cleo. And Anthony, what would you like to see happen next?
Yeah, I'd very much echo Cleo that, having doctors, the medical community advocate for these issues is helpful. We've seen that through lots of public health issues in the past, and currently. Partly, I mean, hopefully the awareness is going to, drive some individual people to make sort of different choices around the cars they are buying. But I mean, I think the big changes are going to be really, around sort of taxation. And so, parking policy is changing. And so in Cardiff and places, and that's, going to make a bit of a difference. But so hopefully all of these things together are going to mean there are, fewer of these vehicles on our roads, and roads are safer, the air is cleaner, and I think that would be a good news story.
And that article, Reducing the Health Harms from Ever Larger Cars, is available on bmj.com. Again, links from the podcast notes. The BMJ has also published a collection on transforming women's health through innovation, led by the BMJ's international editor and head of scholarly comment, Jocelyn Clark, who joins me today. Jocelyn, thanks for joining us.
Thanks for having me, Sophie.
So the BMJ has got a strong track record of publishing on women's health. How does this new collection add to the contribution, and what are some of the key messages for our general medical audience?
Thanks. Yeah, I mean, I think it's been a great fit that the BMJ went into partnership with the Gates Foundation to develop a collection of articles that looks critically at this emerging field of women's health innovation. I'm really proud of the journal's track record. And I think recently it's become almost fashionable to be talking about women's health with this kind of innovation lens. But the new visibility and attention to the field is very welcomed. And in fact, it's broadened the community really much larger than we've seen traditionally. So now we have femtech entrepreneurs, we have business interests, we certainly have a lot of economic cases being made around advancing women's health and the kind of prosperity it will bring to economies if we do close the so-called women's health gap. So it's bringing a lot of new players into the community that was traditionally centered on academic research and policy. And whilst, of course, that's new for us, and there's a lot of challenges associated with that, it's very welcome so that we do advance progress in women's health, which has been frustratingly slow.
Thanks, Jocelyn. It seems that the collection covers wide areas within the field of women's health innovation. What most surprised you, or do you feel are the most significant findings or recommendations from these articles?
Well, the first one is this. The first surprise is the one that's frustrating, which is that over decades of advocacy for women's health, that progress in funding, in R&D, in the inclusion of women in clinical trials, in sex and gender disaggregated data, things that we've been calling for over decades, including in the BMJ, are still not being realized. For example, despite women being 50% of the world's population, they have never in history been represented in those numbers in global health funding. Less than 10% of US National Institutes of Health funding, for example, goes towards female-specific conditions. Less than 5% of global health R&D in the world goes towards conditions that women either uniquely or disproportionately are impacted by. And something like less than 2% of venture capital health investments go toward women. And women do outlive men, as we know, but they do experience a global health gap, which is about 25% more of their lives are spent in ill health. So there's clearly a gap that needs to be filled. And that's, a frustrating one to confront. But at the same time, this emerging field of women's health innovation perhaps can help us close that. The ways that the collection, I think, contributes to the conversation is, principally adding scholarship to an area that's rapidly growing. These are 7 articles, all women-led, by a number of authors from different disciplines around the world, representing 14 different countries globally. And together they examine issues like data science, artificial intelligence, diagnostics, other digital tools, decolonial thinking, the barriers to women's advancement in careers and leadership, and talk about how we can unlock some of those domains in order to advance more funding, more attention to the development of women's health innovations that, both draw on women's expertise in their design, but also deliver products that meet the unique needs and lived experience of women. And for the BMJ, what we're interested in are the things that matter most to us, which is we want the path to transforming women's health innovation and to improving women's health and rights. We want that to be ethical. We want it to be evidence-based. We want it to be equitable. And of course, we want to, support those working in the field to also question the systems of power that allow for women's health to not be prioritized in the way that it needs to be.
Thanks, Jocelyn. It's a really rich and diverse selection of articles that you've discussed there. I just wondered that, after this collection, what do you think needs to be prioritised next?
Well, what I'd like to invite listeners to do is, absolutely have a look at the collection, which, as I said, is 7 independent analyses that are multidisciplinary, authored by international authors, all open access on bmj.com. We have 2 external experts that wrote editorials for us that really do emphasize the need for us to be asking tough questions about power. Women, as we know, deliver most of the healthcare in the world, but women shouldn't just be the deliverers of innovation or indeed just the beneficiaries of what we're proposing in the women's health innovation field, but women should be architects of those innovations. They should be the architects and the designers of what those solutions are, so that we can ensure that the products, the technologies, the digital tools that we develop actually reach the women that need them. As one of those editorialists, Dr. Aber Okereke, said at the webinar that we hosted a few weeks ago to formally launch the collection, innovation without equity is not innovative.
The current ecosystem during which or through which the innovations have been developed and implemented is actually is not designed to reflect women. It decides who gets funded, who is heard, and whose lives are actually deemed worthy of improving. And as an African woman in global health, I've actually learned that innovations without equity can actually reproduce the same hierarchies and discriminations that those innovations claim they wish to disrupt. So it's important to recognize that, unfortunately, women are still not in the positions of power as often as we want, despite our rhetoric about inclusion, and we've been talking about inclusion for a very, very long time.
How can readers and listeners learn more about this collection?
The collection, which we developed with the Gates Foundation, is fully available, open access on our website, bmj.com/collections. We also hosted a webinar that we've just put on the website where all the authors of the articles presented rapid fire key messages from each of their articles, and we were able to have external experts reflect on the collection. And we had a very nice conversation about how to chart an ethical, evidence-based, and equitable path forward for women's health innovation.
Thank you, Jocelyn. That's it for this episode. Cameron will be back in a fortnight for more medicine and science. I'm Sophie Cook. Thanks for listening.